Hello to everyone. In this video, we'll be discussing a brief discussion on the topic of intraventricular septal defect. So, it is a congenital heart defect in infants, in newborns. Okay, so it is a VSD, that is ventricular septal defect, and is one of the most common septal defect in the cardiovascular pathology. Now, what is the statistics of this? How many cases occurs per 1,000, 1 lakh? But so around 300 cases are found in the 1 lakh birth of the infants or newborns. So about it is about the third most common all congenital defect. Okay, so now what is the pathology? What happens is in this case, so there is a septal defect, means in the heart we have 4 chambers. You know that upper one is 2 auricles and ventricles. In between ventricles there is intraventricular muscular mass septum. So if there is any hole or pathology in the newborn, or it is not fully developed during the embryological period development of the infant or baby, so in that case, if the opening is remain open in this case, then the blood from the left ventricle comes inside the right ventricle, and this leads to the high pressure inside the lung, and which can lead to further pulmonary hypertension. So that leads to the complications. So that is the main pathogenesis, you can say, or somewhat how this disease develops. So the pathogenesis of ventricular septal defect is linked with the hemodynamic, that is the direction of the blood flow that I told. Now, as the left ventricle has a massive muscle mass, and as the chamber has high pressure, and most high pressure is present in the left ventricle, so that is why it has high pressure, and opening in the intraventricular septum leads to the blood flow from left to right, what I told. Now, what can be the causes? So the most common causes, it can be genetic, okay, or that can be chromosomal abnormalities in the case of patients suffering from Down syndrome. This is one of the most common pathology. Now it can also develop during the gestation period, or the mother is developing a baby. In that case, if mother is suffering from any infection like infection with rubella, or mother is having use of drugs, tobacco and alcohol, that can also lead to diabetes. If the mother is suffering SLE, systemic lupus erythematosus, and overweight, obesity can be the cause, and radiation exposure for the mother, and phenylketonuria. So these are the main causes which can occur later on during the pregnancy of the mother. Now, classification, VSD classification. So we have 4 classification, is basically on the location of the membrane of the intraventricular septum. So first case is perimembranous. It is the most common, that is around 80% develops in this area. Then comes your muscular, subpulmonary, and defect in the bringing tract. So in this diagram you can see these are the different types of ventricular septal defect. You can see the outlet, this is the chambers, this is ventricles, and between this is your intraventricular septum. So I told you first one was perimembranous, so it is 80%, and it can be due to aortic regurgitation, aneurysm formation. And then is your muscular, 20%, and then is your supraclistal or subpulmonary, it is around 5 or 6%. Okay, and the last one is inlet AV canal, that can be due to Down syndrome. So these are the holes you can see, these are the sides according to location ventricular septal defect is classified. Now, if the disease occurs later in the adult phase, if it is not developing in the newborn or in the child phase, in the adult phase, it can lead to pulmonary hypertension. As I told you, the pressure will increase in the lungs, and that syndrome is actually called as Eisenmenger syndrome. Okay, so that is the main pathology here. Now, next comes your symptoms. Now, in the case of symptoms, what a patient you can see, there will be dyspnea, that is shortness of breath, difficulty in feeding, poor weight gain, and large liver will be there. And there can be patient with recurrent respiratory infection will also develop. And severe cases, there will be murmur or palpitation over the heart area. So after development of this ventricular septal defect by birth, now what can be the further complication to the child? The child can suffer from pulmonary hypertension, as I told you, and this hypertension in adult phase is called as Eisenmenger syndrome. Okay, so this is another pathology. So Eisenmenger syndrome will also complication for this VSD, ventricular septal defect. Endocarditis, that is the inner layer of heart, infection in the inner layer of the heart can develop. There will be left ventricular heart failure due to increased pressure inside this ventricles, and the fourth will be subvalvular aortic stenosis. So these can be the complication after the development of ventricular septal defect. Now, what are the methods, or what we can examine, or what the diagnosis we can do? Now, on auscultation, how the doctor will examine? So he will observe an diastolic murmur on the position of your third and fourth intercostal space, and systolic murmur on the fourth intercostal space. Now you can see this this is normal. You can see there is a normal circulation of your heart. You can see the blood is coming from aorta here, and this is your left auricle and your left ventricle. Okay, so this is your actually between the two ventricles there is septum. I have marked this, you can see the labeling. So this is actually your ventricular septum. So what is ventricular septal defect? So you can see there is a gap between this septum. So this gap is actually leads to the abnormal circulation inside the heart. Okay, so that is why it can lead to further complication, heart failure or arrhythmias, strokes, irregular rhythms can occur. So this is the main pathology or main observe you will see inside the heart. Okay, so what diagnosis you can do? We can do the ECG. In ECG you can see hypertrophy of right ventricle or right bundle branch block is another pathology. You will examine the X-ray. You do the chest X-ray to examine the organ of the heart. Okay, so now you can do echocardiography also. Okay, after the development of VSD you can do MRI, you can do cardiac catheterization. Cardiac catheterization is basically done for pulmonary hypertension patients and before the treatment of VSD with invasive methods. So if the treatment is with invasive methods like any stenting or patching work is done, then in case you can before the treatment you can do the cardiac catheterization. Okay, now in the case of treatment what you can do? In the case of treatment what you can do? So like surgical treatment is not required in the small case or asymptomatic patient. There is no need of surgical treatment. A small defect is there, but if and also there is no load on the left ventricle, then in that case we doesn't do any surgical treatment. Now what can in what case we can do the surgery? So in the patient has recurrent endocarditis, that is an infection in the inner layer of the heart. If there is leakage of the blood from left ventricle to the right ventricle, in that case we can do the surgical treatment. Or if there is increase in the pulmonary pressure due to increased blood flow from left to the right. Okay, so this is actually observed by echocardiography, that is QP is to QS. If this ratio is more than 1:5, then we have to perform the surgical treatment. So now in young children that is not in the adult phase, in young children we actually do the surgical closure of the defect during the infant stage, or we can do the percutaneous placement of the implant covering the defect and pulmonary artery ligation. So this treatment is actually palliative treatment, it is not the permanent treatment, pulmonary artery ligation, but this can also be done. Okay, so now in this diagram you can see, and this is the diagram you can see. So this is your aorta. Okay, you can see this is the hole, this is zoom part, this is the hole, you can see this is your VSD, ventricular septal defect. Okay, now you can see the blood is coming from this area, that is your left ventricle to the right ventricle. So from here the blood will come here. Okay, so this will lead to increase in the pulmonary pressure. So this is actually the hole which is present from the birth inside the heart. So for that we used patching here to close the heart. You can see this is the patchwork, you can see this one. So this is actually done as a placement of the patch or implant covering the defect. So this is actually done in the young children during the born of the newborn, that is the surgical closure of the defect. So this is a diagram you can see. So this is a treatment we do for the ventricular septal defect. So this was the ventricular septal defect, intraventricular septal defect. Thank you.